Thank you, Luca, and I'm very privileged to, try and give you some thoughts on this issue. I hope I represent the views of my colleagues in industry, but I think we do share a very consistent view, I would imagine, in terms of the importance of patient advocacy. I mean, firstly, just some comments as a clinician. It sometimes surprises people, but I don't think it should do any more, that everybody working in drug discovery and industry is really interested in finding a medicine. I mean, that's what drives them on. They want to find new medicines, and certainly as a clinician, that's why I moved into industry. It was to, it was to make a difference and have something else to hand across the table other than sympathy when, treating patients with severe respiratory disease. And just within the context of what we do within industry, patients have been put, and they sort of always have been, but not enough probably, but they've been put absolutely center stage in terms of the focus of our drug discovery programs, for the obvious reasons that if patients and clinicians don't want these medicines and don't like these medicines and don't perceive the benefit from them, we won't sell any drugs. There's a very, very simple equation, which is good. It's very healthy, but as we know, drug discovery is difficult, but that's a very good starting point. So certainly within GSK, and I know within other companies, there's that ethos right at the heart of what we do. So in GSK, it's called Focus on the Patient. So if you ever come to GSK in Stevenage, you go into the canteen, and it's there's a big wall of glass, and written across it is Focus on the Patient, and there's a pair of eyes. So I mean, it's something, there are flags that you go into the site that say Focus on the Patient. So I mean, the message could not be clearer, and obviously it's the right one. And a lot of the scientists that work in drug discovery, actually, unlike many academic institutions, are not always, rubbing shoulders with clinicians who are treating the patients that they're trying to find cures for, or they're not, of course, seeing the patients themselves. So again, we often have patients coming into the company to give presentations, to spend time, and it's unbelievable how much impact that has when a scientist says, just hearing that person's story was just unbelievably motivating, and it lasts, a lot longer than just the conversation. I take that for granted as a clinician because it's something that I think I carry around, because of my experience. But actually, for the basic scientists, it's phenomenally powerful to expose them to those stories. So it's something that happens very, very regularly. We do it all the time, and we've already had one on IPF, and we have one on scleroderma coming up. And we're going to do RA, interstitial lung disease, as well. So that's what sort of in terms of how this can impact what we do in terms of finding medicines. There's a kind of a much more there's another level to this, I think, which is about the difficulties in being able to change the way we develop medicines. And I think the Cystic Fibrosis Trust example is a very, very good one. It's the foundation, and there's a trust as well. That is an incredible story, and I've certainly been part of work to find medicines for cystic fibrosis. I mean, what a difference that organisation makes to the process. It's incredible. I mean, they're sort of part biotech, part pure sort of patient advocacy group, part sort of awareness raising, etc. There's so many things they do, but having them a part of what we're all about, it just speaks for itself. So there's a model that's absolutely worked. If any company wants to make a drug in cystic fibrosis, that's where they go to. That's where they go first. And they say, we've got this idea, and they talk to that body, which is astonishing. So I think that speaks for itself as a model that could work. And maybe just the final thing about this body, this colloquium and patient advocacy, I think it's phenomenal that you've brought this into this meeting, because clearly what you've got here is the beginnings of that total integration of patients, scientists, drug developers, and so on. And it is very important if you want to remove some of the barriers to making medicines, because they're not all about biology, and they're not all about drug companies trying to make money. They are about the perception of the disease within the people that provide healthcare, and from the people that define you know, the framework in which we develop medicines, i.e. regulatory bodies. So again, it's what you need if you want to move those other institutions, those other bodies, to help get medicines, because there are still barriers. And again, I think the CF Foundation, and now in COPD as well, I think they're starting to move regulators to look at different outcomes, to recognize the importance and the impact of the disease on patients' lives. You know, it's a very easy thing to say, and it's obvious to anybody who has a disease or treats the disease, but, you know, moving that to something that becomes quantifiable and recognizable is actually a huge hurdle, and it's something that we currently lack in IPF. So I think that there are some immediate objectives that a closer involvement of patients could bring, and I'll leave it there.
I just want to mention one thing briefly. You mentioned the COPD Foundation, and they've created, I mean, I think you're alluding to this international consortium on biomarkers, which, again, the COPD Foundation is partially funding that along with the collaboration of the pharmaceutical industry. And I think that that's a really good model. You know, when we're talking, yesterday they're talking about, you know, the collection and maintenance of biospecimens and other kinds of data. You know, and again, in going back and you know, maintaining a surveillance registry, or, you know, looking at biospecimens from the past. So I think it's a good model.
You reminded me of one other thing I wanted to say, which is I'm really pleased to see that you're called pulmonary fibrosis and not idiopathic pulmonary fibrosis. I mean, for lots of reasons, but I think also because there is a balance of scale that might be important when there are so many interstitial lung diseases that you know, devastating.
I mean, that's really interesting. I mean, you bring it because we have people with, you know, rheumatoid arthritis that have pulmonary fibrosis that, you know, the Rheumatoid Arthritis Foundation doesn't seem relevant to them. Even people with sclerodermal lung disease and other forms of fibrotic lung disease. So, and again, it's, I mean, it's been talked about at this meeting, you know, there's a huge spectrum of fibrotic lung disease, and the borders aren't always clear. They're kind of hazy.
I think that's great.